Good morning, everyone. Good morning. This is Bill Miles with the Hilton Island-Bluffton Chamber of Commerce, and we're certainly delighted to have you joining in to our weekly teletown hall. And we appreciate you who are listening in today. Also, those who are watching on the Beaufort County channel, as well as watching the Facebook Live posts. You know, it's hard to believe that we're halfway through 2020, and gosh, what a year it's been so far. I was thinking back earlier about back to January 1, and I know that you, like me, probably were excited about the possibilities of the new year. We're still shaking hands with just about everyone we met. The word social distancing made absolutely no sense whatsoever, and getting tested meant something very different. However, one thing hasn't changed. We're all still glued to the computer and reading emails nonstop. But one thing that has changed is Zoom has become much more recognized now, and something that we're all doing on a frequent basis. Heading into the second half of the year, I think it's time for us all to hit the reset button with certainly renewed energy, purpose, and resilience. And we're looking forward to what the second half of 2020 will bring to us. We know we're going into the July 4th weekend, and it's traditionally one of the busiest weekends of the year. And I'm proud to tell you today that the Chamber has launched phase 2 of the Path Forward Readiness Plan, called Staying Safe Together. And the key word there is together. We've coexisted with our visitors for over 50 years, and this year is no different, except we're doing it with masks and a few additional health and safety measures in place. As part of our Staying Safe Together initiative, on Saturday, we'll once again be handing out free masks at local grocery stores during peak visitor hours. And this week we'll be at Harris Teeter on the north end, as well as Harris Teeter on the south end. With the mandatory mask mandates in place for both Hilton Head Island and Bluffton, our goal is to help inform residents and visitors and ensure that everyone is masked up. We've also distributed materials to our hotels and our home and villa rental companies to pass along to guests, encouraging visitors to leave nothing but their footprints behind on our beaches and respect our healthy and safety laws and environment. I'm pleased to relay to you that this weekend, the beaches on Hilton Head Island, that the town of Hilton Head Island has increased the capacity for trash receptacles, as well as additional trash patrols in an effort to keep our beaches as clean as possible on one of the busiest weekends of the year. And Mayor McCann and Steve Riley will be on the call with us today, and they may have more to add with that. We're fortunate to live in the Low Country with some of the most giving, creative, innovative residents who care about our community. And hats off to Senator Tom Davis, Dhec, the South Carolina National Guard, and Hilton Head Hospital for hosting free testing events, allowing record numbers of individuals to be tested for COVID-19. The next one will take place on Thursday, July the 2nd at USCB's Bluffton campus, starting at 10 a.m. That's USCB's Bluffton campus, starting at 10 a.m. tomorrow. 10 a.m. tomorrow. We have a rapidly changing environment in our nation, our state, and in the Low Country. And today we're going to talk about what's happening in business, real estate, healthcare, and more. To get us started today, we're pleased to have with us again the Executive Vice President and Chief Policy Officer of the U.S. Chamber of Commerce, Neal Bradley. And Neal will talk about what's happening in Washington that impacts all of us, our region. And Neal, we're delighted to have you back with us today. Welcome.
Well, Bill, thank you. It's a pleasure to be back and with you all again today. Hearing about the beaches on Hilton Head, I wish I was physically there with you rather than here in our nation's capital. It sounds like a great place to spend the weekend. So just a quick update on a few things going on in Washington that may be relevant. I know we've talked before on this call and in other settings about particularly the small business programs. Just wanted to give everyone a quick update from overnight. As you all know, that the PPP program, which has been one of the main lifelines for small businesses across the country, its deadline in law was actually yesterday, and ended applications for loans ended yesterday at midnight. Shortly before midnight, yesterday evening, the Senate passed an extension bill to extend the application window through August 8th. And this morning, we've been working with the House to try to get that cleared so that that remains a viable tool for small businesses across the country. Now, we know that that alone is not going to help us kind of weather the recovery. And so quickly, we're turning our attention to what is commonly known as the Phase 4 legislation. So this will be the follow-on to the CARES Act, and we expect consideration of a final Phase 4 package at the end of July, with enactment sometime at the very beginning of August. This is a very much a moving target in terms of what will go into the Phase 4 package. Some of the key priorities that we have at the U.S. Chamber of Commerce and things that we think will become part of this package include liability safe harbors for businesses, healthcare providers, and nonprofits. One of the things that we've been tracking across the country is an unfortunate rise in litigation tied to claims about exposure. We know as we reopen, inevitably there's going to be more spread of the coronavirus. And sadly, there are some unscrupulous lawyers who are trying to take advantage of that to bring lawsuits against small businesses, nonprofits, and others, alleging that they should have been taking additional steps to prevent transmission. What's most likely to happen is what is called a safe harbor, where businesses, institutions of higher education, and others who follow the public health guidance, such as the guidance that Bill was just talking about, that you have there in the Low Country, have a safe harbor against any type of litigation claims kind of going forward. We think that that is almost certainly to be included as part of this Phase 4 package. We also know that there's going to be additional assistance needed for businesses. So it's not going to look the same as what was done in the CARES Act, but particularly in areas like leisure and hospitality and restaurants that are the slowest to recover as we reopen. An extended bridge is going to be necessary. That's most likely to take two forms. One is very low interest long-term loan programs. It's gaining a lot of interest in the Senate right now, for small businesses to be able to access some of the programs that have already been established, for example, for mid-size and larger businesses, but make the programs tailored to smaller employers. In addition, there's a lot of interest in what's called the Employee Retention Tax Credit. This is an expansion of a provision that was included as part of the CARES Act, which provides up to a $5,000 tax credit for employers who are maintaining employees on the payroll. That was a one-time credit. We think that that's likely to be extended and expanded as a means of helping employers offset some of the costs of maintaining both employment and employment-related expenses going forward. We're also know that some assistance is going to be necessary for state and local governments and school districts. We've seen a tremendous drop off in revenue for local governments, just like we saw in businesses. That's led to a pullback in construction spending, capital investment, and layoffs. Last month's jobs report, the headline was 2.5 million jobs added. The private sector actually added back 3 million jobs. The government sector, led by local governments in particular, lost 500,000 jobs. And so, if we want to kind of avoid the repeat of some of the things that happened in the Great Recession, providing a bridge for local governments, particularly units of education, so that they can reopen in the fall and deal with the rising costs of reopening in a socially distanced way, is going to be incredibly important. We also know that, despite our best efforts at reopening, a lot of individuals are going to remain unemployed for an extended period of time. And there's a couple things that we believe need to be done here. One is that we need a more targeted approach to unemployment benefits. One of the things that was done in the CARES Act was a benefit that was provided that for the majority of the unemployed means that their unemployment benefit was more than their original take-home pay when they were employed. We've heard from countless businesses who tell us that that's become an obstacle in bringing employees back. We think that, as a simple matter of policy, someone shouldn't make more on unemployment than they made on employment, but we also shouldn't leave them destitute with unemployment. So having a much more targeted benefit there makes sense. We also know that the economy is going to go through a reallocation process, and we're going to have to help individuals through that process. Some businesses will not return. We've already seen bankruptcies from some of the nation's most kind of premier brands. Some of those institutions, some of those businesses will not come back. That means for those individuals who were employed there, the most important thing we can do is get them quickly into job training, skills programs, job placement services that are helping them get connected with the new jobs that are being created. The quicker we can do that, the quicker we can get people off unemployment, the quicker we can get consumer spending back up, and the quicker we can return to economic growth. Let me conclude with one point that's not as optimistic as maybe some of these others, but I think that's worth discussing. One of the things that we've been collaborating with other business groups here in Washington is on biweekly polling, where we are measuring consumer attitudes about returning to pre-COVID activities. So we're polling every 2 weeks people who in the past year had been on an airplane, stayed in a hotel, been to a conference or a convention, gone to a movie in a movie theater, been on a cruise ship. And we were measuring and asking them how quickly they were likely to return to those activities. And what we saw at the beginning of April was that there were basically three groups of folks. There was a core group representing about a third of folks who had done those activities in the past year, who, as soon as the government said you could do it, they were ready to get on that cruise ship, get on that plane, do what they did before. There was another about 40% or so who really wanted to see assurances. They wanted to know that when they returned, that there were going to be deep cleanings, that people were going to be wearing masks, that things were going to look and feel different, and that people were watching out for their safety. The last component were folks who said, I'm not returning to any of those activities until there's a vaccine or a therapeutic. What we've seen since April is those numbers had moved, that more and more Americans were willing to return to their normal activities. And the number of Americans who wanted a vaccine were moving into the group that said, I'm simply looking for assurances. That held steady until about 2 weeks ago. And about 2 weeks ago, we started marking a decline in the number of Americans, first time since April, since we began this polling project, who said, I'm not ready to go back. I'm not ready to get on a plane. I'm not ready to go to a hotel. I'm not ready to do any of those things. Very much tied to when we saw the uptick, particularly in certain states, of the return of the virus. And so what we've seen is more people now moving back into that vaccine category and more people moving from ready to go into the assurance, which has drawn us to conclude that one of the most important things that we can do, both as business and community leaders, but also looking to our government, is to provide those level of reassurances. The more reassurances we can provide, Bill, what you were talking about at the beginning of the call about masks and enforcing that and educating people, that if we want to avoid kind of a second round downturn in the economy, not to mention a further round of closures, as we're seeing in some states that they're being forced to retrench their opening plans, that part of that is going to have to be a strong push on these public health measures that both transmit the spread, but also give people confidence that they can return to their prior economic activities. So that's a long way of saying kudos to what you're doing in helping drive that there in the low country. You're going to see an expanded effort, I think, at the federal level to push that messaging as well. We're in conversations this morning with other national trade associations, figuring out how we help drive this message and kind of reverse that downturn that we saw over the last 2 weeks. With that, I would love to take questions, feedback, any advice that you have for us, anything that you're worried about that we need to be watching out for.
Neal, thank you. The first question comes from Karen, and referring to the litigation and safe harbor, how important is it for a business to document what they're doing to prevent the spread in case litigation comes about?
I think it's pretty important. I think what you want to document is the policies that you have in place. If you've implemented deep cleaning policies, mask requirements, if you've implemented social distancing, you simply want to record that. I don't think this is a question of you have to record it every day, but you want to document the policies that you've put in place that are different than the policies that you had when you were open in January. And that you want to document that you're maintaining them on some type of regular basis. I don't think this should become a bureaucratic issue for businesses. You shouldn't be devoting massive amounts of time to documentation, but simply keeping good records of that. We've talked to chambers who are advising their members to, particularly as this mask debate heats up, if you're requiring masks and you have a sign in front, want to take a picture of the sign, put a date stamp on it. That's just a good thing to have around in the future if it becomes an issue. I think some simple common sense things like that make sense.
Neal, thanks. One other question is about infrastructure, and while the U.S. Chamber is hunkered down in this, the wings are so much broader. If you just touch for a minute on what you all are doing as far as infrastructure goes, would be helpful for our listeners today.
Yeah, I mean, I am incredibly frustrated on the topic of infrastructure because, one, we've needed it for a long time. Everyone on this call, I know knows. This is the perfect opportunity to begin making investments in infrastructure. With the capacity to be able to do it, the need is there, the timing legislatively, the current infrastructure programs all expire either in September or at the end of this year. It ought to be the perfect time to get it done. We have a bipartisan bill that increases surface transportation spending by 25% that's come out of the Senate committee. We've been trying to get a floor vote on it. We were trying to get action in the House. The House is taking action this week, but unfortunately, it's on a $1.5 trillion bill that is completely partisan and therefore has no chance of passing the Republican Senate or being signed into law by the president. The president's already said he's going to veto it. We've urged Republicans and Democrats to kind of abandon these party line partisan votes in favor of adding the pieces together on which they have agreement and getting that done, because making progress is better than making a political statement. Unfortunately, that's kind of gone unheeded. And I think what is going to happen is that we'll have a party line vote in the House. The Senate will now not likely take up its legislation, and that when we get to the end of September, we'll have a simple extension of the current funding. That's better than letting it expire, but it also means that we're not making the additional investments that need to be made. And so I wish I had better news to report to you. I wish I was telling you that we were on the cusp of doing the right thing here, but this is another issue that has unfortunately gotten caught up in election year politics. And at the moment, we don't see a path to get it back on track, given the limited number of days and the other things like that phase 4 package that have to get done.
Neal, we know your schedule is incredibly busy, not only today, but each and every day. And we thank you for you and your team and everyone at the U.S. Chamber and the great leadership you all are providing. And just do me one favor. When things slow down a little bit, we'd love to have you come to Hilton Head Island and see us again.
We'd love to. And my wife loves it down there. She grew up going there every summer. And so we're excited to get back.
Great. We'll make that happen. Thanks for joining us today, Neal.
Thank
Have
you.
a great day.
Bye-bye.
Bye. As we move forward to our next speaker this morning, we all certainly know the housing market will play a significant role in determining the pace of the current economic recovery. We saw some data that was very encouraging for the month of May, and even more encouraging is what's going on locally. And we're delighted to have Gene Dhec with us this morning. And Gene, please share your point of view from the Hilton Head Area Association of Realtors, where Gene is the CEO.
Great, thanks, Bill. Well, it's interesting getting to follow the U.S. Chamber, a different view regarding the economy and businesses. And I certainly have sympathy for my friends in hospitality and travel. Prior to my career in real estate as the CEO here, I was a corporate travel agent for many, many years. So I have friends still in that business too, and certainly sympathize with their situation as well. But Locally here, I will tell you, our buyers are back. Our buyers are returning quickly to the housing market, and it appears real estate is recovering much faster than most other sectors in the economy in this current recession. The demand really has been staggering, but the inventory remains very low. Locally here in the month of May, month supply of inventory was down 16.4% to 4.6 months of inventory, indicating that the demand increased relatively to the supply. And interesting, and as predicted, after being quarantined in city apartments, Realtor.com released its May report that shows that consumers are showing an increasing preference for suburban and rural areas as they return to the market. In May, online listing views on Realtor.com in suburban zip codes grew by 13%, nearly doubling the pace of growth of urban areas. And I know my friends back up in Connecticut in the Fairfield County area just outside of New York have told me that their houses are selling quickly, and other parts of Connecticut, as well as people realize that they ready to get back into a larger home and have more space and out of that city, the density that a city brings. So if you know a local realtor, they will tell you they are extremely busy here in the Low Country. The pace of property going under contracts have been substantial, and some properties are receiving multiple offers. So let me give you some numbers for the month of May to put it in perspective. So in 2019, it was a great year in real estate. Everybody was happy with the selling process, and things were going very good. But inventory still has remained low, and last year it was remaining low for a long time as well. So in the month of May of 2019, 565 properties went under contract through the Hilton Head multiple listing service. In the month of May of 2020, so it's just coming after this pandemic, as things started to reopen, 629 properties went under contract. That's an increase of 11.3% year over year. And in June, we're showing just as strong. So let me give you an example for the week of June 17th to the 23rd. So that 7-day period in 2019, 152 properties went under contract. And this year, that same week, 237 went under contract. So that is a real wow. We see a lot of people in here coming to purchase real estate quickly. Some realtors have begun to holding open houses, but are limiting the number of homes, number of people in the homes, social distancing, wearing masks, and wiping down touch areas. Others are continuing with virtual open houses. One realtor told me they did a Facebook Live open house where questions can be asked during the open house in the comments area of the tour, which I thought was interesting. And then I also want to let you know, just for some fun here on Hilton Head, if you had your name in for the HGTV Dream House giveaway that was just happened in spring and you didn't win, the property is now on the market for $1,595,000 located in Windmill Harbor. You can give Rob Reichel with Sea Pines Real Estate a call if you're interested in purchasing the HGTV Dream House. We know it's a beautiful home and had the opportunity to go see that through the Chamber of Commerce. So we are fortunate here to see this spike in real estate, but we still need to be mindful of our unemployment rate, our increase of local assistance needed by our neighbors for food and rent and mortgage assistance, and the need for attainable housing and transportation in our region. So as an association, we have done a couple of drives. We have done a rent assistance drive where our realtors contributed, and we put $6,000 back out into the community for rent assistance. And this month we are doing, through our community outreach committee, we are doing a food drive, a realtor-wide food drive, where our realtors will help to restock those pantries in our local market. So that concludes my report. Bill, if there's any questions, I'm happy to answer them.
Jean, those numbers are staggering. 11.3% year over year last year to this year, and then 85 more homes sold or under contract this June than last June. So yeah. Terrific news that you're sharing, and we appreciate you coming on and what you're doing with you and the realtors continue to do throughout the region. Thank you.
Thank you.
Okay, our next we're gonna focus here next. We're delighted to have the Chief of Staff at the U.S. Marine Corps Recruit Depot from Parris Island with us. and he's certainly going to be a great addition to the call this morning. And C.J. Williams, we're delighted to have you with us.
Hey, good morning, everybody. Like you said, Colonel C.J. Williams, the Chief of Staff here at Parris Island. Very much appreciate the invitation to talk this morning. We know the value of what we bring to the Low Country, but more than that, we certainly value our relationships here in the Low Country. So, really appreciate the opportunity to speak this morning and perhaps raise some of the doubts or ask some of the questions that anybody has on what's going on in the depot. Obviously, very isolated by its nature. We're always kind of a restricted area, but I'm happy to try and share that with you this morning. So on behalf of Brigadier General Julie Nethercott, our commanding general, good morning and thanks again. So to get to the COVID-19 impacts to Parris Island, I'll shape that by saying, that we have received a lot of questions from our retired community, from the military retired community, and from the other communities around the Low Country about why we're continuing to conduct recruit training, in the midst of a global pandemic. And the answer is somewhat elegant, somewhat simple, and that is that our nation's enemies are not taking a knee during this time, so we can't take a knee either. So we need to be able to fight through this thing, just like we did in all the way back 1918, 102 years ago. We had to do that during a pandemic flu and fight World War I at the same time. So that's some pretty good multitasking, and that's what we're trying to do here currently. So in the interest of meeting our end strength and meeting our national security requirements, we have got to continue to make recruits. And in order to do that, we've instituted a lot of measures here, not just here, but in the recruiting force. So if you don't, the Recruit Depot is responsible certainly for recruit training, for transforming young Americans from civilians into U.S. Marines. But we're also responsible for all of the recruiting of the young men and women that come here from the Mississippi River to the East Coast, from Maine to Puerto Rico and parts of Europe, where there are U.S. bases. So we're also responsible for that. So wearing both of those hats, we've instituted many measures. So COVID-19 began to impact us like most folks back in March of this year. We saw our very first case on 24 March. We wanted initially to take a pause in shipping, and were granted that by the Secretary of Defense in order to prepare ourselves here. Some of the measures that we instituted were to move the racks in our squad bays 6 feet apart and to provide for a 2-week staging capability. And that is additive. Our recruit training is the longest in the Department of Defense at 13 weeks. And the 2 weeks that they come and join us in their staging phase is additive. So it's 15 weeks now that they're down here in the Low Country. So after 24 March, we brought in a company called a Global Contingency Contract, and they built us an expeditionary staging area, 2 camps, both of which that could house folks in a quarantine status in 25-person bays, so 25 people in each bay. And we understood that was an initial attempt, but it was the emergent requirement. So we accepted risk at 25, understanding that the lower the number goes, obviously the better the vector is controlled. We wanted to get to 2 to 4 person rooms, and we began working on that. So they built us the expeditionary staging area, and we began to ship again in early April after about a 3-week pause from shipping new recruits. We put those into the expeditionary staging area and immediately turned, they went through their 2 weeks of restriction movement, ROM, and then they started recruit training. Those first recruits that came here and went into ROM are now approaching graduation, which is great news. And they're graduating at about the same rate of attrition as recruits pre-COVID. So our next phase was to look at how we could do the 2 weeks off of the depot, because the depot, as you may know, is purpose-built, right? It's purpose-built, and we use all of our facilities in order to conduct recruit training on a stasis basis. We use all of our facilities to support the 15 training companies that are down here. So we needed a place that was off-site. And this is an interesting little footnote in history. We had read, a couple of us, the book, The Great Influenza, and I recommend it. And in that book, they talked about the Marine Corps and what we did in order to support our involvement in World War I. And we actually took over the University of Florida. I hate to say took over, we rented, much like we're renting now, the Citadel. Back then, 1918, the schools were closed, the businesses were closed, just like it is today. And so we used the University of Florida to provide a 2-week staging before the recruits came up here to Parris Island and start their journey. So that's what prompted us to look at some local schools. We looked at a few, and we landed on the Citadel because it, as well, is purpose-built. It is the South Carolina Military Academy. And so it's a barracks format, and it had 2-man rooms so we could control the vector better. It has a large chow hall or dining facility. It had large classrooms, a lot of outdoor spaces where we could socially distance and keep those poolees, recruits safe for their 2 weeks. And that's been working very, very well. So after their 2 weeks there, we put them on buses. We drive them here, and they go to our iconic yellow footprints where they begin their journey to become U.S. Marines. And that is now turned into a steady rhythm. It's going very well. We will ship 13 weeks in a row, which is unprecedented in order to make up some of those earlier gaps. And now we need to look at what's next. Okay, what's next is very likely going to be a hotel option, not likely in the Low Country because of the weather impacts that we can suffer, as you know, is just as well as we do, the destructive weather that can roll through here in the latter parts of the summer, early parts of the fall. So we would need something about 100 miles out of here. So we're going to leave the Citadel so that they can get back to their business this month. So by the end of the month, we'll be out of the Citadel and we'll be into a very large hotel option for a matter of a few months. And we're exploring some options to utilize some military installations that are as far away as Tennessee in Fort Knox. That we haven't decided on that yet, but that's the sort of environment we're looking for, is to move there, and that provides good protection from the weather and certainly the ability to conduct the 2 weeks of ROM. And it's within a reasonable driving distance to put them on buses, and we call that protected transportation, to put them on buses that have been deep cleaned, come down here to our yellow footprints. So some of the, and I'll stop here in a second, but some of the additional impacts to the Low Country are that we have had to further restrict the island. That can be an emotional event for some. We certainly have ridden through that, but what we've really seen is that the team in the Low Country, our retired community, the Low Country team, and Parris Island have really come together to support this national security imperative that we continue to make recruits. So what we've had to do is completely restrict access to the base from anybody who doesn't, initially we did, anybody who doesn't live and work here, we restricted the base. We relaxed those about 5 weeks ago now, so that our retired community, so if you have if you are a bona fide military retiree, you can come onto the base from Monday through Thursday, and from 06 to 1800 or 6 p.m. And the reason we're not allowing access on Friday, Saturday, and Sunday is because our new recruits, our new Marines, graduate on Fridays, and then they're allowed base access for Liberty. And then they mount buses on Tuesday, and they now go directly to Camp Lejeune for the School of Infantry for their next phase of training. Normally, but pre-COVID, they would graduate on Friday, and there'd be many families here, and they would take them with them, and they would receive 10 days of what we call boot leave. They'd get boot leave, and then after those 10 days, they would report to the School of Infantry. So we've had to, in order to protect this pipeline, the entry-level pipeline, we've had to cancel the boot leave. We've also had to cancel the family participation in our graduations, which is unfortunate but required, and limit the access to the base in order, again, to protect that pipeline as they move through. We look every day at how we can relax some of those restrictions. Obviously, with this second plume that's going on right now, the increased number of cases that we're seeing across the country, that won't happen anytime soon. Unfortunately, we don't have a timeline. Some services or some other services are planning for 2 years. I'll share with you that we're planning along with them for that, but we're not certain just yet how long we'll be in this restricted status. Our goal is to get back to stasis so that we can have public graduations and welcome the families, and they can be a part of that very, very special moment when their young son or daughter or grandson or granddaughter, whomever it is, graduates and becomes a U.S. Marine and then moves on with their journey. So that's all I have. I'm happy to take any questions that you have. Again, no timeline on when we'll relax the restrictions, but I certainly hope everybody understands why we have to do that in order to protect what we're doing here to support national security. Thank you.
Colonel Williams, thank you. And there were a couple questions that you have already answered. The name of the book that you're referring to was The Great Influenza, and I look forward to reading that. But most of all, thank you for what you do each and every day and serving our country and developing the recruits. It's a tremendous honor to have you on with us today, and we look forward to continuing to hear periodic updates from what's going on with you there at Parris Island.
Well, thank you very much. I appreciate that. The honor is mine to serve. Certainly, it's an honor to serve here in the Low Country. We love it here. When we do retire, we'll become part of your permanent community down here, my wife and family. So thank you for inviting us today, and we certainly stand ready to answer questions today and any day that you may have them. Thank you.
Great. Thank you so much. We're going to move things a little more local now. We're going to, our next speakers will be from the town of Hilton Head Island, our mayor, John McCann, as well as town manager, Steve Riley. Mayor McCann, welcome. Mayor McCann, are you unmuted?
Here we go. Can you hear me, Bill?
Yes, I hear you. Yes, thank you. Welcome.
It's been a busy week for us. The town council unanimously passed an ordinance requiring face masks in all commercial spaces, both by the employees there and people coming into their place of businesses. I must say that we spent a lot of time working with Billy Keislinger in the city of Beaufort, and a lot of time with May Sulker in the town of Bluffton, and putting together the best ordinance that we think we could have. And I must thank the Sheriff P.J. Tanner for his guidance in this whole thing. He's been very, very helpful in us getting it accomplished. The town, through its code enforcement group, will be assisting we're the backup for the sheriff on the code enforcement, with our fire rescue inspection team doing education for that. I must thank you, Bill, and the chamber for the mask program last Friday over at Kroger's. It went very, very well. And both the town will continue on that as well as the chamber. And this is a very important time for us. It was amazing how Josh Gruber, with his leadership of the senior staff of the town, came together and implemented a plan that will not only do enforcement, we'll do advertising, we'll do education, and everything we need to run a great town like we have today. And I thank you, and Steve will say a couple words now.
Thank you, Mayor. Well, Bill kind of stole most of mine because the Chamber's been a great partner. We have information on our website about signs that businesses can download and print for themselves and put up. Those are on our website, but Bill and his team already put them up on their website as well. There's an extensive FAQs on our site, but again, Bill and his team have also put them up on their site. We've got the ordinance itself is on the website. We're working with Palmetto Breeze. We do have the trolleys running again, and beyond the clean that they're doing, they're also going to be posting signage for us. All of our town vehicles are going to have magnet signs on them that urge people to mask up. We're working on some customized masks, and we'll be joining with the chamber and passing those out, and also sharing them in other venues through our own staff. And that's kind of the big part of it. We hope we're ready for July 4th. Of course, there's no fireworks, no public fireworks. We are concerned about private fireworks. We're urging people not to engage in that. Fireworks are prohibited on the beach. It's going to be a very high tide late in the evening on July 4th, and we're concerned about activity out there, and urge folks to please kind of tone it down and keep this a low-key, safe 4th of July. And with that, Bill, I'll hand it back to you, or we'll take any questions.
Steve, thank you. Mayor, thank you. We've got a couple questions here. One question comes from Doug. If a restaurant patron does not wear a mask, is it the responsibility of the restaurant manager to enforce?
That is our desire, yes. It's an obligation of the patron, but it's also an obligation of the business.
Okay, thank you. Another question. And while I was watching the council meeting yesterday, I heard Josh Gruber go into some details on this. probably don't expect you to have all the answers, but maybe a link to a website where this question could be answered. And the question is, if a customer claims they have health issues such as COPD or asthma, are they required to provide proof of such claim?
We have been using the guidance of Southeast ADA Center, and I can't. If you Google search that, you'll find it. Their point is that if you have a medical condition, it doesn't exempt you, it doesn't allow you to just run around wearing no mask and claiming I'm exempt. The expectation on the business is that they will provide an accommodation. An accommodation can be doing things over the phone, it can be ordering your groceries online and taking curbside delivery. It can be methods that don't require you to have to go into that business, but it doesn't exempt you necessarily from wearing a mask. But Southeast ADA Center is a good resource if you've got questions about that.
All right, Steve, that's helpful. Thank you. And then another question comes from Kathy. On one of the electronic signboards, it says wear a mask in public. Is it mandatory in outdoor locations to be wearing a mask?
If you're not in a commercial space, Bill, and you're walking in the street or jogging, you don't have to wear a mask. If that's the question?
Yes, thank you for that answer. And for our listeners today, I know there'll be additional questions that come in. If you want to email us at pathforward.org, that's pathforward.org, and that'll be posted in the chat box here in just a minute. We will take those questions and send them to the town of Hilton Head Island or the town of Bluffton. And in the subject line, just put Bluffton or Hilton Head Island, and then we'll forward those directly to the municipalities to respond. And we appreciate what you guys are doing. It's encouraging regarding the beaches over the 4th of July. And thanks for the update today, Mayor and Town Manager Riley.
Thank you all.
Our next speaker this morning is the CEO of Hilton Head Regional Healthcare, and Jeremy Clark. Welcome back, and we look forward to hearing an update on the hospital this morning.
Well, good morning, Bill. I appreciate the invitation again. It's good to be back with this group. As in previous weeks, Hilton Head Regional Healthcare continues to operate effectively and safely. Today, I wanted to start off by giving everyone an update on what we're seeing here locally. So right now, across our two hospitals, Hilton Head Hospital and Coastal Carolina Hospital, we have fewer than 10 COVID positive patients in-house right now. None in the ICU, none in critical care, and none on ventilators. So that's a little bit more than we've seen in previous weeks. So it's something that we're watching very closely, but still represents fewer than 10% of the total number of patients that we have in our two hospitals. On an outpatient basis, we are seeing more positives in the community with all of the testing that we are doing. Similar to, I think, some national trends, our positive patients are tending to be younger than they were in past months, but they are also local patients. These are not all tourists that are coming up positive. So there's a lot of our locals here that are testing positive. What I guess we want everyone to know is that if we do see a surge of hospitalized patients or patients that need to be hospitalized, we're ready for that. We spent a lot of time really building this safer standard of care around the principles of testing, screening, spacing, and cleaning. And, we spent a lot of time developing really good plans to expand bed capacity, expand a ventilator capacity back in March. And fortunately, we didn't have to use those plans. We didn't have to implement them. But we are spending a lot of time now just kind of refreshing our memories of those plans, getting them out, making sure that everything still works as it was originally designed, just in case we see that surge of patients. I mentioned testing earlier. We are doing a lot more testing. So between our two hospitals, every weekday morning, we are doing outpatient drive-through testing at the two hospitals for any patient with a physician order. There's no cost to the patient. There's no appointment required. And collectively, we're testing about 500 patients a week in that process. Additionally, we are very fortunate to have some great community partners who we've been working with to host testing events that are open to the entire community without a physician order. And we conducted one very successful one last Friday in Hardyville with St. Stephen AME Church. We tested around 400 people there. And then we conducted a very successful one on Hilton Head Island on Monday, a couple of days ago, where we tested over 1,500 people. It was a great event. We had great turnout, and truly would not have been possible without incredible support from Hilton Head Fire and Rescue, volunteers in medicine, the National Guard, Beaufort County Schools for allowing us to use that site, and Dhec. So we're really fortunate to have those great community partners to help us pull off these great testing events that there's obviously a demand for. So we're really helping to allow people to have access to testing, and then hopefully also providing some education on how to stay negative, and then if they're positive, what they need to do to help keep the virus from spreading. So a lot of testing that's going on right now. But testing is really only one part of it. I mentioned we've created a very safe environment inside our hospitals, and we appreciate our patients trusting us again and choosing to receive care, choosing to get that elective surgery taken care of. And we've been doing those cases now for a couple of months. And one way that we've created that safe environment is through masking. So for the last few months, we've required masking to be worn by all of our staff, clinical and non-clinical, whenever they're in close proximity with anyone else. And that's also another reason we feel safe in allowing our visitor policy of one visitor per patient per day. We feel safe in doing that because our visitors are required to wear masks as well. So again, it's all about creating this safe environment. And so we are very appreciative of our local leaders for recently enacting the mask ordinance to support us and help keep us safe and help keep our community safe as well. So we're very appreciative to our local leadership for doing that. So just to wrap up, Bill, I want everyone to know that we remain ready. We've created a safe environment that we can deliver care in today. The patients are returning and trusting us with their care. And we remain ready to handle a surge of COVID positive patients if indeed they come. So it's something we're watching very closely in the community and inside the walls of our hospital. We really appreciate all the leadership from our state and local officials, and we appreciate everyone's support for our caregivers. So Bill, I'll turn it back over to you and see if there are any questions.
Jeremy, thank you. And just to recap, so fewer than 10 in both hospitals, Hilton Head Hospital and Coastal Carolina, none in critical care, none in ICU, and not any on vents.
That is correct.
Well, that's encouraging. And thank you for the safety precautions you and your team at the hospital continue to take, and the leadership role that the hospital has always played in our community and continues to exemplify that today.
Great. Thank you. And I just remind everyone to wear a mask, wash your hands, and keep your distance. Stay safe.
Very good. Thank you, Jeremy. Moving on now, we're fortunate to have back with us Dr. Michael Katka. And Dr. Katka is with South Carolina Dhec. And thanks for joining us this morning, Dr. Katka.
Good morning. Thanks. It's good to join you again. So brief update on the numbers. For the past week for the state of South Carolina, we're reporting 9,684 confirmed and 75 new probable cases of COVID-19. This brings the total number of people with the disease to 36,399. This includes confirmed and probable cases. For Beaufort County, for the past week, this includes 308 new confirmed cases and 3 new probable cases. Total there for the county is 1,219 confirmed and 4 probable cases. For the Hilton Head zip codes 29926 and 29928, there have been 67 new cases for a total of 254 cases. And for the Bluffton zip codes 29909 and 29910, there have been 96 new cases reported for a total of 381 cases. So unfortunately for the state, we're also reporting 62 additional COVID-19 related deaths in the past week. This brings the total number of people who have passed away from the virus to 735. There have been 2 additional deaths reported in Beaufort County individuals, bringing the total there to 18. So we continue to see an accelerated growth of cases in South Carolina and several states across the country. I'd like to take a little time today to talk about masks specifically, because masks are emerging as an important factor in reducing the spread. So the original recommendation from the CDC was based largely on expert opinion that masks may be helpful, but that's now being backed up by a lot of data that the masks may be pretty effective at reducing the transmission. So requirements to wear masks have been linked to reduced infection rates in areas where they've been mandated. There's one projection that suggests 95% of Americans wearing masks could prevent up to 33,000 deaths from COVID-19. So what does the mask actually do? So remember that the virus spreads not through the air on its own, but in tiny droplets of moisture that exit the nose and mouth anytime anyone breathes, talks, coughs, or sneezes. And someone can be contagious with the virus up to 2 days before they have symptoms or may never show symptoms of infection. So even a simple cloth mask can filter out some of these moisture droplets and ultimately reduce the amount of virus that someone puts into the environment when they don't know that they're contagious yet. The mask may filter out some particles coming in from the environment when someone breathes in, but it appears to be more effective at trapping the particles immediately as they exit the nose and mouth. It's certainly not a perfect solution, and it should only be used along with other measures, including physical or social distancing and good hand washing. The masks provide additional protection, but shouldn't be considered a replacement for those practices. There are those who should not wear masks. This includes children under 2 years old and anyone who has trouble breathing, is unconscious, incapacitated, or otherwise could not remove their own mask without assistance. Important things to know about mask. A simple face covering is sufficient for most people. It's what I'm wearing when I go out. I'm still saving surgical masks and 95 respirators for my friends who are in clinics seeing patients now. It should be worn at most times while out in public. As was mentioned in the question earlier, there are certain exceptions for outdoor activities where masks don't necessarily need to be worn as long as efficient social distancing can be maintained, such as being out jogging. You should always wash your hands before putting on the mask. You should make sure it fits snugly against your face and that you can breathe easily through it. It should fit over your nose and mouth and be secured under your chin. And care should be taken not to touch the front of the mask while wearing it or when taking it off. And you should always wash your hands immediately after removing it. Disposable masks should be thrown away, or cloth masks should be washed after each use. We thank all South Carolinians for their careful consideration for the well-being of their neighbors when they're wearing masks. That and other preventive steps will be essential for curbing the current rise in cases and controlling the spread of the virus going forward. And as always, I'll wrap up just reminding everyone that more information on the virus and the steps Dhec is taking is available on our website, scdhec.gov/COVID-19. And I'm happy to take any questions.
Okay, Dr. Katka, thank you. The first one comes from Paul, and Paul is asking how contact tracing is working.
So we're still it's still a work in progress. I'll say it's we've had a dramatic rise in cases, which has made it difficult. The other issue is with when we were in lockdown mode, people had a lot fewer contacts. With more things opening up, there's a lot more contacts, meaning a lot more people that need to be followed up on. So there have been some delays reaching out to people. We've tried to reach out to healthcare providers to show them where the resources are for their patients so that they know what steps they can take before they get contacted by Dhec.
Thank you, Dr. Katka. Next question comes from Misty, and she's asking, are there any updates from Dhec on the plan to allow immediate family members in nursing homes and assisted living communities?
I don't have a time frame for that yet. I know that's been a big topic of discussion in the agency. They're looking at factors that will make it safer, where we don't put the residents at risk, such as doing outdoor visits and that sort of thing. I don't have a time frame yet of when we'll announce plans for being able to implement that yet.
Dr. Katka, thank you so much for being with us. Your updates are always most informative, and we appreciate you taking time out of your schedule each week to join us.
Thank you very much.
Our next speaker this morning is going to be the Vice President of the Chamber's Visitor and Convention Bureau, and that's Arianna Pernice. And as I mentioned earlier about the phase 2 of our Path Forward Readiness Plan, Staying Safe Together, Ari's going to talk to us just a little bit about that plan. Ari, welcome.
Thank you, Bill. Great thank you for having me, and I'm happy to share all the information regarding our path forward efforts and our second phase of the promise. So if you will, I'll just share my screen. I'll just need to be allowed to share it. Thank you. Great. If everyone can see my screen, I have brought you to hiltonhead-blufftonchamber.org. And as you can see, we have here the header image that stays prominently placed where it talks about the promise, both for Hilton Head and Bluffton, South Carolina, and the importance to mask up and stay safe together. As you see that here, you can also see the green bar at the top. If you click here, you'll be taken to what we're calling the hub. And the hub is a location where you can find all resources and information pertaining to the Safety First, the pledge seal that everyone was versed on in several weeks in the go, and then also finding all about staying safe together and making the promise. So this again is the one-stop shop for all efforts. And again, I'm going to go to make the promise. If we go here to making the promise, what we're here to reiterate is our values as a community. So it is talking about those 4 key values, but it's also talking about those safety protocols that we've heard so much about over the past several weeks regarding staying safe. So it's about keeping our distance, washing our hands, masking up, and obviously coughing or sneezing in a tissue or cloth. You can take the promise or make the promise by submitting your name here. And this is really for all community members, for all visitors, just saying that we're doing our part to stay safe and make sure that everybody else is safe. And so again, this launched earlier, I should say late last week, and we've had already 104 people make that promise. Again, some other opportunities that we've had in terms of making that message heard loud and clear. We have created printed and digital rack cards, as you're going to see that on the left hand of your screen. Again, talking about just ways in which that we can further connect with our area as well as staying safe. And then we also have our campaign going out to our visitors as well as our residents, talking about just staying safe together. So the importance of all of that wrapped up. And then I would just say, please access the hub, and you can access that through the pathforward.org. And that again is the pathforward.org. So Bill, I hope that was a nice overview. I'm happy to answer any questions, and thank you for everybody on your support. And we're looking to staying safe together with everyone.
All right, thank you, and appreciate that. And please continue to go to the website and encourage your friends to sign up for the promise and participate in masking up and staying safe. You know, as we move forward into this 4th of July weekend, we're certainly thankful to be able to celebrate that and our nation's independence. We know that it's going to be strong. It's going to be important for us to all to be strong as we go through these next several weeks, if not a month or 2, in masking up and sticking together. So thank you for joining in today. Thank you for being a part of our community, and thank you for caring. Have a great 4th of July, everyone. Bye-bye.